Good evening. Welcome, everybody. My name is Frank Borges. I'm the Associate Program Director and Capstone Director for the Master of Healthcare Administration program within the Division of Health Policy and Administration in the School of Public Health at the University of Illinois, Chicago. Thank you so much for joining us. And also thank you very much to everybody who submitted questions and hope for outcomes beforehand. We've shared these with Quint, and he's incorporated answers to many of these questions during his talk. Just a note on logistics. For those of you who want to ask additional questions during the talk, please submit those via the chat. We will forward these to Quint, and Quint has kindly agreed to record answers to these additional questions that we can then share afterwards with attendees. So, what originated as a very small talk for our MHA program has ballooned into something much, much larger. I think we had close to 300 RSVPs for the event tonight. I saw clinicians, clinical leaders, senior leaders within healthcare organizations from across Chicago, as well as from our very own UI Health healthcare system. I believe this level of interest is attributable to both the focus of tonight's talk, as well as the reputation of our speaker. The topic, confronting chronic stress and burnout in healthcare, would have been highly relevant a year ago. Nursing burnout has been a long-standing and unresolved issue in healthcare, and more recently, physician burnout has captured the public's attention. This last year has raised clinician stress and burnout to unprecedented levels, and every day brings new stories chronicling the impact of the pandemic on our clinicians, serving on the brutal front lines of caring for and experiencing the incalculable tragic deaths of COVID's victims. But as I think today's talk will address, the true costs of the pandemic on our clinical workforce are really yet to be truly acknowledged and confronted. And I'm hopeful that today's talk will be a small step towards a much needed process of reckoning. UIC's healthcare administration programs are very much focused on the interface between health system administration leadership and the clinical workforce. Confronting the chronic stress and burnout from the pandemic should not and cannot be tackled individually. Within delivery systems, this is an issue that will require systems level leadership, strategy, and action, and will require a deep partnership between clinicians and systems leaders. Again, I'm hopeful that today's talk will be a small step in starting such a dialogue. So onto the second driver of tonight's turnout, our speaker, Quint Studer. For many of you, Quint will likely need little introduction, but for those of you who haven't had the privilege of hearing Quint speak, let me tell you a little bit about him. Quint Studer is a respected thought leader in patient experience and employee engagement. His book, Hardwiring Excellence, is amongst the most read books ever published in healthcare. Quint led Holy Cross Hospital in Chicago to Hospital Magazine's Great Comeback Award, then went on to guide Baptist Hospital in Pensacola, Florida, to place in the top 1% nationwide in patient and employee satisfaction. Many credit Quint for increasing healthcare's focus on employee, physician, and patient engagement. After years of working in hospitals, Quint founded the Studer Group in 2000. The Studer Group itself received the Malcolm Baldrige Quality Award in 2010. And in 2014, Modern Healthcare presented Quint with its first Healthcare Marketing Visionary Impact Award. During the last few years, Quint founded a not-for-profit called the Studer Community Institute, which focuses on early brain development, entrepreneurship, and civic engagement, all of which support its mission of improving the quality of life in communities. This work is published in the book, Building a Vibrant Community. Quint's latest book is the Wall Street Journal bestseller, The Busy Leader's Handbook. In addition to all the aforementioned activities, Quint also serves on the board of the directors of TriHealth, Hazel and Betty Ford, and CAMI, which is the accreditation body for our program. And in his spare time, Quint is also the co-owner of the Pensacola Blue Wahoos minor league baseball team. Quint, welcome to UIC.
Well, it's nice to be here. Thank you very much. I see I've got Karen Cook here. Karen, nice to see you. Carrie Klima, one of my relatives, is here. I haven't seen her in a while, so nice to see you. It's great to be here. University of Illinois Chicago's got a special place in our hearts and our family. My nephew played baseball at the University of Illinois Chicago, and he played there in the 1993, 94, 95 season. He went to Australia with the team in 1995 because they wanted to get, play, it's a little warmer there, and then come back. So he came back on December 23rd. His parents grew up in Beverly, went to Mount Carmel High School. My wife's a Mother Macaulay grad, for those of you who are curious about that. I'm a Lyons Township, LaGrange, Illinois person. And anyway, he came back and his parents picked him up at O'Hare. They brought him home. He stayed there for a little bit. And then he went out to see his buddies. He hadn't been around, and actually went to his brother's house and his sister-in-law's house to see his nephews. Fell asleep there. He was pretty tired from Australia. And he got up and decided he'd rather go home and sleep in his own bed. And he was killed in a one-car accident December 24th on Western Avenue. I've got the phone call that morning, Christmas Eve morning at 5:00 in the morning from my sister-in-law, Jean Martin, and she said something terrible has happened. And I'm thinking of uncles and things like that. And she said, Brian Fitzpatrick is dead. And I remember getting in the car. We were living in Homer Township, now Homer Glen at the time, loading the kids in the car and going to Beverly, where the Fitzpatrick family was there. And of course, the older sister, Sue, brother, Mike Jr., and with the family, Kathy and Mike. And of course, they were, like anyone would be, just devastated, in shock. Probably the thing I remember most was his girlfriend pulling up in the driveway and getting out of the car. And I think she wanted to understand, did it really happen? And they came out and she just collapsed in the yard. What do? You just spend the whole day saying, I'm so sorry. Christmas, we went back to the house in Beverly, just said, we're so sorry. The next morning was the wake, or the next day, December 26th. And next to the casket, the University of Illinois Chicago team came and lined up along the casket like it's opening day. And they pretty much stayed standing almost the entire time. The next day, I got a phone call from early in the morning from Brian's dad, Mike, and he said, Quint, we have a priest from St. Barnabas doing the service on behalf of the church. The baseball coach of the University of Illinois Chicago is going to talk on behalf of the team. Would you talk on behalf of the family? So, of course, you say yes, and the priest talked, and then the college coach talked, and then I did. And ironically, they had Brian's baseball cap on the altar, and he played for this team called the Flames. And just about 6 months earlier, for the first time ever, I'd been introduced to speak. And I'm not a speaker. I have a speech impediment, for crying out loud. I never thought I'd be doing this. And I got up to speak, and the person introduced me as a fire starter. And he said, Quint Studer's a fire starter. And I wonder what he meant. And he said, we need somebody to help ignite our flame in healthcare. And he explained that early civilizations, firefighters keep the flame going. I that really wasn't much of a leader till I was in my early 40s. I'm a real late bloomer in all of this stuff. And I didn't have any formal training. I just went through the ranks, like a lot of us. About 95% of people in leadership didn't get a degree in leadership. They were a good nurse or a good radiological technologist or a good accountant. And they talk us into taking these difficult jobs because they tell us it's only going to be interim. You do this on the interim. We don't realize interim's going to last 35 or 40 years sometimes when we go into these situations. And there's Margaret Stansel, who's been with me during this conversation. I'll get to her in a bit. So I got up and I saw his hat. And I thought it was so something that here I'd just been called a fire starter, and here Brian played for a team called the Flames. And I talked about Brian being a fire starter, and Brian's flame isn't with us physically, but we can bring his flame with us spiritually, with us wherever we go. And so if you wonder where the term fire starter and all that came from, a lot of it's got some improvement down at the University of Illinois Chicago. They also retired his uniform. It was number 19, by the way, at the University of Illinois Chicago. And Margaret had to be with me about 3 years later. I got asked to speak in Oak Lawn Hospital, Christ Hospital. And I flew in. By now, I'm president of Baptist Hospital, so I'm no longer living in Chicago. And it was about 300-400 people in the room. And I called Mike and Kathy the night before I was going to speak. And I told them I was speaking at Christ Hospital. And they immediately said, I was actually Oak Lawn Hilton, but speaking Oak Lawn Hilton, speaking to people from Christ Hospital. And they said, that's where Brian was taken. And then Kathy, his wife, who's deceased now also, I don't think she ever recovered from a broken heart. She died only about 4 years after Brian at 54 years old. She said they were so kind to us. Can you imagine that? Somebody who lost a son goes to the hospital and the thing she thinks about him is how kind they were. So I got up that morning and at Oak Lawn, they sent a whole bunch of people over to hear me speak. And I just thanked them on behalf of the Fitzpatrick family for being so kind to my sister-in-law, Kathy, and my brother-in-law, Mike, and gave my talk and then went back to Baptist where I was president. And maybe a couple of weeks later, I got a note from, and I thought it was a note because I was president of Baptist from a patient or family, but it was actually from a note from a nurse at Christ Hospital in Oak Lawn. And she said, I heard you speak. I was the one that was with the Fitzpatrick family. I'm the one that was with your nephew. I want you to know that there's not a Christmas and the holiday season that goes by that I don't think about that family. And I'm not a motivational speaker. Somebody wrote, are you going to give us another motivational speech, blah, blah, blah. I try to give people skills. I try to give people tools, because the best motivation we need in healthcare is what we want most of all is how can we be helpful and how can we be useful? And that's really what this thing is all about and all about tonight. And all I want to ever be for you is helpful and useful. And that's what I pray for every morning. So Frank heard me speak at an AUPHA meeting. And because I've anyway, we can get into that later. I've offered to speak at universities for nothing, like you. And I'm grateful. I'm grateful because I get to be helpful and useful. And that's what I want to do today. So as we move into this, a little bit about me. First of all, I'm a recovering alcoholic. And again, I got, if you're a recovering alcoholic, south side of Chicago ain't a bad place to be. Let me tell you, you have the second largest 12-step meeting in the United States in Lamont. It's called Lamont Oaks. So I'm sort of excited to be there. And some of the meetings I used to go to were at Christ Hospital and so on. And I bring that up because if you wonder why I care so much about mental health, because I've dealt with it. I've dealt with therapy, I've dealt with depression. And I think one of the nice parts about the hospitals and Studer Group is we weren't afraid to talk about mental health issues. We weren't afraid to ask people to go get help. I was talking to a CEO the other day and he had 2,000 employees. And I said, if 200 of them might have breast cancer, you'd be doing mammograms like crazy. But you probably have 200 employees that are dealing with certain mental health issues right now. And I will tell you the most underutilized service in healthcare is the employee assistance program by far. The biggest, one of the 1, 2, or 3 biggest drugs that are used by hospital healthcare employees is antidepressants. Now, nothing wrong with antidepressants whatsoever, but also it's nothing wrong to get therapy to coincide with antidepressants and so on. So this is a subject that's really close to me. So I was a special ed teacher and people ask me, well, how did you become into healthcare leadership? And I think leadership gets transferred because so many of you say, well, how can somebody that's a non-clinician supervise clinicians? Don't sell yourself short, because that would mean if we had that philosophy, then we would have to say, then clinicians shouldn't supervise non-clinicians. And that would take every clinician out from any being president of a hospital because they're going to supervise a lot of non-clinicians. So I do believe leadership is very transferable. And I think sometimes not having a certain skill set means you count on the people that do. When I was at Baptist Hospital, I hired a neurosurgery nurse who came from another city to be our head nurse of the ER. And at first the nurses went wild. How can she run an ER when she's not an ER nurse? In about 6 months, they told me it was the greatest thing that ever happened because she sat there and trusted them and asked them questions and didn't sit here and think, I know better than you. So I think we have to be open on that. So what did being a special ed teacher help me with in healthcare? Let me explain. When you're a special ed teacher, you're dealing with children and parents are terrified. Carrie will know we just lost a cousin with Down syndrome in the last couple of years. And what happens is the parents are terrified that will my child ever be able to live independently? Because the worry is, well, who's going to die first? Nobody wants their child to die before them, but if my child's not independent and I die before them, what's going to happen to them? So the first thing you do is you assess a child. And the first thing you do as a leader is you assess the situation. I'm not a big person that you go in and read a book and hire a consultant and you treat. The first thing you do is you diagnose, just like you diagnose any situation. If you're in finance, you're diagnosing your aging of your cash. So we diagnose. You diagnose a child. Second thing you do is you set a lofty goal. I think we were setting lofty goals before James Collins did a big, hairy, audacious goal, because we want to make sure that child reaches their maximum potential. In fact, the vision of Studer Group was to help human beings reach their maximum potential. And then once you set a lofty goal, you get everybody on the same team to align everyone. What's the music therapist? What's the physical therapist do? What do you do? And then you look for tools and techniques. And one of the things that when I was going to school, is Mark Gold at the University of Southern Illinois went into institutions and showed that you could take people by breaking complex steps down to simple steps. You could take people and have them perform better than anyone thought. If it wasn't for him, basically, I really truly believe we wouldn't have gotten all these people and adults out of institutions and colonies because people had given up or even said to do that. Mark Gold was a world changer, and I was lucky enough to be in college when that happened. And then, of course, you use reward recognition tools and so on. When one of the hospitals at one Hospital of the Year by the American Hospital Association, somebody came up to me and said, "How can a guy with a special ed degree run a hospital?" I said, "Well, as a special ed teacher, you diagnose, you set goals, you treat, reward." When I got done, he said, "My gosh, I wish I had a special ed degree now. I might have been a little more successful." So with that, my alcoholism got me to know behavioral medicine. And I ended up getting to know behavioral medicine because of my own alcoholism. I'm in my 39th year now of recovery, and still very active in that world. And so what happens is they had a job open in their treatment center for someone to work in the community. And because of my own recovery, and I was working in the school systems, I set up a student assistance program for children that were going through challenges with moms and dads and things like that. And they hired me to be community relations rep. Then I ended up calling on hospitals who had people in treatment. And from there, I got to know human resource directors. One of them hired me director of marketing and then planning. And then they put me over a physician group. And then I got to come down to Chicago. And then I came down to Pensacola to be Baptist Hospital. And then I got to start my own company. In 2015, Huron bought my company. In 2016, I resigned, which engaged a 5-year non-compete. And the 5-year non-compete's been extremely challenging for me. And I understood exactly what I was getting into, but I tell you, it was really tough. Those first 2 years, I had stomach aches, headaches. I was like the surgeon who they won't let operate. So you just put your white coat on and you walk up and down the hallways all the time. And, but it is what it is. But luckily I had some lifelines thrown to me. Tri-Health allowed me to be on their board of directors, which has been helpful. Hazelton Betty Ford, as you can tell, is a sweet spot in my heart. They allowed me to be on their board. I'm very active in AUPHA, and they threw me a lifeline. And the lifeline was, and I'm grateful for Huron to let me do this. My non-compete's over, I think, in 48 days or something like that, is to speak with you. So you've been a lifeline for me because you've brought me back to my calling. I think healthcare chooses us as much as we choose it. And I think we have a calling. And I want to be helpful and useful. And I know you want to be helpful and useful. So that's a little bit of how I got here. And I know maybe you weren't expecting that. But I think, sometimes in colleges, people say to me, "Well, Quint, tell me your career path." And I'm saying, I'm not sure everybody should want to follow my career path. Go to Cork and Carey in Beverly if you want to start. Anyway, so the reality is, it is what it is. But this is an important topic for me. And let me tell you how I got into this topic. Being on the board of Hazelton and Betty Ford, certainly due to the pandemic, we see the impact of it. We see the impact from the behavioral medicine treatment facility. Being on the board of Tri-Health, which is a 12,000 employee healthcare system with 2,000 active doctors, you see it from the provider viewpoint. You see it for what's happening there. We have weekly calls. What board ever had weekly calls where you're talking about PPE equipment, you're talking about ventilators, you're talking about those types of things. My daughter-in-law is a nurse at Beloit Memorial Hospital. She understands what it's like to work 6 days a week, 12 hours a day, on and on and on, with the guilt of, shouldn't I be home with my children because my children are going to school virtually? Where am I going to be? Over the years, I've talked about that people, particularly clinicians, have more stress than anyone because of the family situation. If I'm president of a hospital or a job and somebody comes in and says, Quint, your boy's been hurt on a playground, the school called, I'll immediately can call the school. And if they say, come pick them up, I'll go pick them up. Why? Because I'm not taking care of patients. If I'm an ICU nurse and I've got a patient or two patients and I know there's not a backstop for me, and all of a sudden the school calls, I got to make a tough decision. Do I disappoint my children or do I disappoint my coworkers? And do I maybe let this patient be in a terrible situation? I get that. I understand that. That's always weighed on me about that. So my whole goal has always been to create great places for people to work as much as possible. So we get into something like this, then I get real lucky again. Diane Hendel, who was a president of Long Beach Medical Center when a disgruntled employee came in and killed his boss and killed his boss's boss. She asked me to write the foreword for her and Mark Goldstein's book, who is a doctor and works mainly in suicide. I did write a book in 2014 called Healing Physician Burnout. I think I was just a bit ahead of the curve back then with it. And she asked me to write the foreword. And she talked about her own dealing with PTSD as a CEO of a hospital, dealing with shootings in her hospital. So I've really learned quite a bit about this. And so I want to share with you today, maybe in about 25 minutes. And if you want to call me, text me, I'm always available to go into greater detail. Then I will answer some of your questions. But for the one that says, what will you get besides a motivational speech? I think that's going to be always your option to see what you get before a motivational speech. When the student is here, the student is ready, the teacher appears. So let's see what we can do today. Rob, you want to put an overhead up? So here we go. Here's number one, and that's how to get hold of me. That's my personal cell phone. I've answered it for years. I gave it to every patient in a hospital. I own a baseball team. I give it to every fan that comes to a game, and that's just it. People used to say, you give your phone number to all the patients? I said, yeah. They said, how many phone calls do you get? I said, not many, but when I do, they're pretty helpful. You learn a lot of stuff and things like that. And it just sort of worked. Next slide, Rob. So anyway, are we treating stress or trauma? And I think in healthcare, we don't like to use the word trauma, just like in recovery, you don't like to say alcoholic, stuff like that at times. But words do matter. And I think what happens is if you don't want to talk about it, sometimes you rationalize it and you minimize it. So absolutely, I want to talk about stress, trauma, but I also want to talk about well-being, because I think that's the spectrum we're on, from well-being to trauma. And in healthcare, you've seen it all. We've been really heavily into stress. I mean, how many talks can you have on resiliency? How many talks can you have on meditation? I am into meditation. I went through TM training. I get meditation, but there's a time if I'm in an airport and the planes keep getting delayed after delayed after delayed, meditation will be helpful, but I might need more than meditation. So nothing wrong with either one. Don't take it like that. But I think we've got to dig a lot deeper than that. So let's talk about maybe, are we treating both? Now, if we treat stress, it will have impact on trauma, but it might not be as far as we want to go when we end up treating trauma. So let's go to the next slide, Rob. So we want to take a fresh look at both of them today. We want to look at how to measure stress and trauma, because I'm a person that's, when I give a presentation, I have a talk that if you identify a problem, you have a human responsibility to bring a solution. Anybody can identify a problem. I used to talk to managers all the time. I said, if you went into a medical records department and you have experience in it, how long would it take you to know the problems of that department? And they would usually say something like, 3 days, 2 days, 1 week. So it's not about problems. It's always been about solutions. So we want to help the workforce in the area of both well-being, stress, and trauma. And I want to give you access to a resource guide, which I think you'll find helpful. So you're going to get some tools out of this. You're going to get an organizational tool, an individual tool. You're going to get a executive, how to maybe look at it, where to go for solutions. And then you're going to get a toolkit. And I'm very excited about the toolkit. So you're going to get a lot of resources when we're done here, if you'd like to use them. Next slide, Rob. So when we look at this, we all know this. You guys are all smart. You're going to the University of Illinois, Chicago. You're all into healthcare. Stress is something that sort of short term. I have stress right now. I had stress to be on this phone call. I had stress before I had this phone call. I had stress leading some of the questions and some of the comments, which actually weren't that nice. Anyway, so there's always a little stress when you go into the audience. It reminds me, I was working with Cleveland Clinic. Dr. Frederick Loop, who's deceased now, was great. And I'm going up on stage in 1,000 people. And right before I get there, he says, well, Quint, how this goes will depend on whether Cleveland Clinic uses you or not. That's not a pep talk you want right before you get up on stage. But I also know when this talk is over, my stress will go way down. But now if it felt like this every day, I don't know if I can handle it. So stress, not that it's forever, but not that I'm saying everything is just always that way, but stress is usually short term, goes away, up and down, and so on. But if you don't know how to handle stress, so for example, I was anxious about speaking to this group, but I have to talk to myself and I have to say to myself, okay, Quint, this isn't your first rodeo here. You've done this before. Okay, usually it works out pretty good. And what the heck, if it doesn't work out, it's not like you can give their money back because they're not paying you anything anyway. So it's one of those things. So I have to do my self-talk. I've gone to a lot of therapy over the years. In fact, my wife teases I've never met a couch I didn't want to lay on for a little bit. And I've learned over the years that one of my methods is to talk to myself, to talk to myself in a calming way, that I've done this before. What's the worst thing that can happen? That's one of my last therapists would always say, what's the worst thing that can happen? And then she'd say, and could you handle it? And I'd say, yeah, even though I wouldn't want it to handle it. So I've been under a little stress, but it'll go away in about 33 minutes here. Next slide, please. So when we look at it, there's organizational stress. And organizational stress is when we start to break down the real communication threshold. I got a call from a CEO. He said, Quint, my employee engagement was really high and now it's really low. And I feel terrible because I worked years building this emotional bank account and now it's gone. And we talked about what had happened. And what had happened is the pandemic moved so quickly that he didn't communicate as well as he wished he could have with the staff. He didn't put in some new methods. But what we did is we had to meet with all the staff and we had them apologize to the staff. We had them apologize and say, here's what I could have done better. Here's what we need to do in the future. And it worked. Not that he built it all back up, but you just can't ignore reality. People start feeling powerlessness. They feel hopeless. Different roles. We have different jobs, different roles. We're doing different things. For those of you to get off point here, I own a minor league baseball team. We didn't have a minor league baseball season, so we turned our stadium into an Airbnb. We have the first stadium Airbnb in the United States of America. We got people that are used to running baseball, making beds now, things like that. But in my daughter-in-law, they have different units. They open up different units. They open up COVID units. And the challenge in healthcare is while we can sometimes staff, we don't have the infrastructure to support the staffing that's going to happen. We've seen that over and over again. And there's a tremendous sense of loss. Not only in patients. Frederick Levin, you can look him up, Fred Levin from Pensacola, Florida, passed away about 10 days ago. Fred Levin was a lawyer I knew extremely well. I got a note from his nephew, said, Fred is dying. If you'd like to speak to him, call this number. And I was on an iPad. And they put the iPad next to Fred. And I told Fred I loved him, how many people loved him. And I was the last voice he heard. Now, not only is that a sense of loss for me, but that's a sense of loss for the staff. It's a sense of loss for everybody. And I don't think we've dealt with anything like this that I've ever been aware of. So you can't say, well, we've been through this before, because we really haven't been through it before. And we'd be conning people if we said we'd been through it before. It's a lot like the Stockdale paradox when you look at him as a prisoner of war and how he went through that. You just never know because you don't know when it's going to end. It's a little similar to the bombing of Germany in Great Britain, which lasted way less than the pandemic is lasting here. Next slide. So what happens with trauma? There's a breakdown in communication. It's so hard to communicate. CEO Mark Clement of TriHealth is communicating more than he's ever done in his entire life. There's a breakdown of trust. It's very confusing in healthcare too, because while some areas are working like crazy, some are being laid off. Some are having reductions of force because when certain states stopped at elective surgery, that closed outpatient. So when you got some people doing less work, you have some people doing more work, and they're not always transferable. There's a breakdown in productivity. And what I mean by that, for some people, they're working less, but for some people, they're working more. When I was a president of a hospital, every day I got a report on staffing, and we looked at staffing ratios. And some days it would tell me we had too much staff. Most of the days it would tell me we had the right amount of staff. And a few days in red, it would say you're short staffed that day because to put up a red flag. So our productivity measures are just wild right now because they're so different. Workers feel powerless, feel hopeless, and there's a shakeup of roles and responsibilities, and there's a tremendous sense of loss. That's the definition of trauma. Now, that is a nice thing, but now how do we dig into it a little bit? Because do we have a solution? Next slide, please. So what I created is, I know it sounds crazy, but we use it in hospitals all the time. When the person goes into a hospital, we have them do a pain threshold. And we don't make it complex. We just basically say on a 1 through 10, now smiley face, sad face, where are you in pain? That's it. We don't argue with it. We don't question them. We don't think, is that true? So, for example, if my wife and I went in with the exact same injury and they asked me what my pain threshold is, I'd say 8. And she'd probably say 2. They don't say to her, well, you should have more pain. And they don't say to me that you big wimp, you're just whining all the time. They accept it. So what we've been doing with organizations is you give this away free. Organizations can go on to a site and they can plug in where they think their organization is in this range of well-being to trauma. And this isn't just for healthcare. Anyone can use this. It's interesting because normally what we get is the predominant of people say 7 and 8. So the biggest category is 7 and 8. Then there's 5s and 6s. Then there's some 4s and 3s. And what I think that shows is we've sort of moved from feeling of stress to a combination of stress and trauma, but that's an organization. So now how do we break it down to an individual? Because I know there's various stress indexes that we use in healthcare. I have them, I've read them, but I wanted to create a little something else. So let me explain what happened to me. I just get lucky. So, a fire department in Houston, Texas, Sci-Fair, read my book, Busy Leader Handbook. And Amy, the chief, called me and we started talking and I got to know her. And so this is what she showed me. Next slide, please. Firefighters and emergency personnel have what they call a sort of a guide they use to say, where am I at this time? So I love this. Now, here's what we're accomplishing with an organization where we give them the 1 through 10. We've now told the organization, we understand this. We understand that you might be somewhere on this 1 through 10 as an organization, and we want your feedback. So now we're starting to tell people it's okay to talk about this, because I got a new book coming out called The Calling. And one of the things we find in healthcare is all the great things that attract us to healthcare, there's a side effect. Years ago, when I had a sinus infection, I asked the doctor to give me medication with no side effects. And he laughed and said, there is no such medication with no side effects. Our good qualities that help us in healthcare also hurt us in healthcare. What I mean by that is we are strong. You are strong people. We have great resiliency. You don't go through what I did in alcoholism and kick back if you ain't got some resiliency. You also don't give up. We keep gutting, and we also don't whine, we don't complain, and we gut it out. These are all the things that are attractive and help us in healthcare. The problem, it doesn't help us as human beings, because sometimes we don't admit we got a problem. We don't reach out. We don't say we need help. And sometimes our organizations don't create that feeling of safety. So for example, again, my whole career, when I've looked at employees with challenges, I say to the supervisor, oh, did you recommend and refer them to the EAP? And they said, I never thought of that. But I bet you if that person came in and said they had a lump on their neck, we'd get them to the doctor. If they said their back was out of whack, we'd get them help. So really, how can we expect the world to get rid of the stigma with mental health, or as Dr. Amen would call brain health, when we're not getting rid of it in the healthcare field. So that's one of my major pushes, is to make this okay. Some people say, I got a note from a CEO about a month ago, and she said, "My God, Quinn, you're so open about your alcoholism. Why are you so open about your alcoholism?" I said, "Because I can save lives. I can save lives." I did a prayer for a healthcare system in Milwaukee this week. And when I got done, a guy said, "I just want you to know I've got 13 years sobriety. And I've always been ashamed to tell people that I have 13 years sobriety. I'm going to be a little more open." I don't think you have to put on billboards, but how can people reach out to you if they don't know it? Do you know when I speak, people sort of get it, all my books? People come up to me, you know what the bigger questions are? I've got a sister that's got a drinking problem. I've got a son that's got a drug problem. That's why I'm there. That's why I'm on that stage, because that's really the gift, is to hold out a hand and help someone else. So I love this slide, because this allows now to tell an individual it's okay for you to talk about these things. It's a safe way to have every human that works in our organization say, "Where are you? Are you thriving? Are you surviving where something might not be right? You're inconsistent. Maybe there's a blend of two. Are you moving into struggling, or are you in crisis?" Because if we can have that and that person share where they're at with us, we now have that conversation that we normally haven't had, and it's in a safe way. Because that's really what we want to do, is take this from under the table and put it on top of the table. So next slide, please. So now we go into the executive, if you're in leadership. So now what we've covered is a organizational threshold. Now we've done an individual one. Now we're moving to more solutions. Bauman and Dahl have looked at trauma, and they said if people there's 4 factors in trauma. Either their foundation is shaken, their people are shaken, their environment is shaken, or their purpose is shaken. So what I love about this, and I'm not going to go in great detail with it, you then can look at this and look at where your organization is, or where your employee is, or where your leader is, and you can then go to, this is where we need to go. Somehow we're lacking this. We need to go to environment. Somehow an area of our employees are feeling more stressed out. We need to go to people. We need to dig into people and go into their employee needs. There's confusion. Well, for this year, for example, I have 178 employees. We threw out our evaluation system this year. And I'm a guy who created evaluation systems. We threw it out because in this environment, it just throws it out. Goals were changing too quickly. Processes were changing too quickly. We just had to sort of go by, here's 12 questions we want to cover. And almost all of them were about, tell me how I can be helpful to you. Tell me the barriers you face. So this is a 4-frame approach. And if you want more, I did a whole video on this that I can send you, but just for time, we're just going to say it's out there. It's great for executive teams. I'm going to give you a few quick examples. Next slide. Somebody lacks motivation. If you went backwards, you'd say, okay, that's purpose or people. So then you dig into where there's about 5 components under each one. There's confusion around priorities, which is a heavy emphasis right now. So let's talk about where we're at on this. Let's make sure our goals are right. Let's make sure our infrastructure is right. Employee organization's uncertainty. Let's go back to purpose and let's talk about the environment. So I'm not going to go into great detail about this, but what we do is we research for answers. I'm not an innovator, I'm an imitator. I try to find tools that will work and look at, can we transfer that into an organization? Next slide. Here's what's really neat. We took that, and my not-for-profit has created a toolkit. And it's a toolkit that's a combination of a few things. From being on the board of TriHealth got $1 million grant to create a sort of a human resource help system for employees that are going through stress in their organization. So they created videos, they created all sorts of resources. And Mark Clement, who's one of the best people in the whole world, said, Quint, even though we spent the money and we developed it, if any other organization in the country could utilize it, just tell them they can have it. We're fine with that. This isn't about peaking healthy employees only in Cincinnati. This isn't anywhere they can get healthier. Our not-for-profit took it and we added some things to it. Now, what we do is we provide it for free for any organization that wants it. And you just put your label on it, your name on it, and you put your things in there like your EAP services, what you can provide, what resources. So if we go back, what you've got is tools at the end of so far today. You got a way to measure organizational stress or trauma or well-being. You got an individual way to measure. Then you had a solution on if somebody's in this category, this is where you go to in the 4 domains that I showed you, and you have a resource guide. So if any of you want this resource guide, just drop me a note at quint@quintstuder.com and we'll send it to you and you can utilize it. And it's been really fun to see different places utilize it. And I think the fact, even though it's not just for healthcare, I think the fact that it was developed by healthcare, TriHealth, is really neat. So you'll see most of the videos and most of the processes are geared toward healthcare workers. Now, the reality is trauma will probably never really, not like we ever had it. I mean, I know, for example, when Brian Fitzpatrick died, I will tell you that this year, Christmas Eve, was the 25th anniversary of his death. And his nephew and my nephew's wife were at our house. And that's what we talked about. And that was 25 years ago. My oldest grandson, Cooper Kennedy, is 21 years old. About 6 years ago, he was burned in an accident. About 30% of his body had 4th-degree burns, and he was in a burn center in Madison, Wisconsin. Now, I will tell you that Cooper is never going to get completely over that trauma because all he has to do is look at his legs, look at his hands, look at his arms, and look at his torso and understand when he was burned. Now, will it get better? Yeah. That's the difference between stress and the difference between trauma. And of course, we always want to look for that well-being. And I'm a lucky guy because I get to talk to all sorts of people all the time in the recovery world, which gets you more into the well-being. Next slide, please. So what are some suggestions? Continue to provide education. So employees know it's okay. They know their organization is thinking about it. They know their organization's talking about it. You know who else is going through a lot of challenges? Our faculty members of universities and colleges. Almost every one of these indicators is hitting faculty members. I'm teaching differently. I don't have the same connections I used to. I have different tools than I'm used to using. It's a whole different ballgame. So faculty members are going through it just like everywhere else. Share the self-assessment tool with the staff. Let them know it's okay and talk to them about where are they? Where do they think they are? And then you can talk about the resource guide. Well, here's a resource guide for you, which includes, of course, anywhere from just self-help. There's a lot of self-help. There's a lot of breathing exercises in it. There's a lot of resiliency, meditation, but there's also a lot of, sometimes you need more than that. Sometimes you need just more than what you're going through. Utilize the organization resiliency scale, the 1 through 10 sort of I gave you, and keep the 4-frame approach of you front and center, because that sort of shows where you can go with it. So next slide. So healthcare workers, you're phenomenal people. You are great at helping others. I know your organization, or wherever you work, is committed to helping you, but we're not good at helping ourselves. I mean, maybe you are. I've been in healthcare a long time. If you want to know how good you are, just go to your EAP program and see how much it's utilized. That sort of gives you a pretty good idea. Now, also, you can go to your insurance product. So if people are not utilizing the EAP, but just going right to insurance for the coverage, you don't know who went, but you'll have a pretty good record. And I think it's because we've been afraid to talk about it. We've been afraid to do something, afraid to maybe even be vulnerable ourselves, because none of us go through life undefeated. You know, I think healthcare is also tough because there's areas we have to be perfect, but then we think we have to be perfect in all areas. And we don't have to be perfect in all areas. You basically just have to do the best you can. So let's go into some of the questions we got here. And I've got them in front of me. Should I just read them off? Frank? Okay, so how can we make nursing not so stressful in this day? I think like anything, you know, first of all, you can't overpromise. I love the book Road Less Traveled by Scott Peck. Life is difficult. Once we accept it's difficult, it's not so difficult. So, but I think you can do some things. And some of the things I've always looked at is, first of all, you have to measure. I'm a measure, measure, measure. You have to measure and find out some things. How good is the leader of their area? Because it becomes very imperative at this time that that leader have human connections with their staff, but you got to make sure the leader is healthy, because leaders get pretty wore out in this thing. I tell people, and this sort of goes off track, it takes 3 positive to 1 criticism for another human being to feel good about another human being. That's data. That's in Quint's tutor. So if I see Grant there, Grant Gilly, and I give him 3 compliments to 1 criticism, when he sees my name, he goes, I like Quint. If it's 2 to 1, it's, I'm not sure. If it's 1 to 1, make me gag. What does he want now? And the challenge we have in healthcare is we're excellent at noticing what's wrong. That's what we do. Some of you, even today, will say, well, here's what he could have said, we should have said, would have said. I'd have people come up to me at conferences and they'd say, well, I said, did you hear anything good? Oh, yeah, I heard a whole bunch of stuff good. So let's start with the good today for a while. So it takes 3 to 1. So one of the things I'd really recommend you do, even to coworkers and to each other, is make sure you're noticing what's right. Now, the other people who never hear what's right are leaders. If you go to your boss's desk, don't think he's hiding under all those thank you cards that he or she has been getting all these years. It just doesn't happen. I tell leaders, when was the last time an employee came up to you and said, I just want to thank you. We're staffed right. Our equipment's here. I got tools and equipment to do the job. I enjoy the feedback. And thank God you fired that employee that was sucking the life out of me the other day. It doesn't happen. If you want to really mess up your organization, if you have sort of a sick sense of humor like I do, just call them tomorrow. Call facilities and engineering and just say temperature's good. Not too hot, not too cold. They have never heard that in their life. So I think there's some checks you make. Do you have the equipment you need to do your job today? Do you have the tools that you need to do your job today? Are the systems working for you today? Because where healthcare people get extra burnout is when systems aren't working. I don't have the tools to do the job today. And I just even say, do you have what you need to do your job today? So I think that's really, really vital in an organization, because our job as a leader is to remove the barriers and create the best culture we can for that person to work. The other thing is we've got to be careful that we haven't backed off some very basic things. So what happens is we get too busy to reward and recognize people. We get too busy to train. I've had organizations want me to do a talk, and every month they postpone it because of COVID. Well, you don't postpone certain things because that's what's going to help us get through COVID. Not me, but training and development. And in healthcare, we're notorious for any time the money gets tight, dropping our investment in people. And that sends the wrong message, because the most important capital we have is human capital. What are 3 things you would give to a patient the best possible experience in a hospital? I would make sure they know who's taking care of them. That means who is touching me? How much training do they have? What is their skill set? Because that reduces the anxiety. 1995 was a rough year. We lost Brian in December, and in July of that year, my son was in an accident, was in critical care. And he was in critical care in Rapid City, South Dakota. We were on vacation. And you're in a hospital you don't know, a town you don't know, and you're terrified. So I said to my wife, because the ambulance picked him up, took him and my wife, we followed. I said, is Mike going to live? Because he was rib cage into his heart, shoulder broken, bleeding internally. And she said, yes. I asked her a question, and she said, there's the doctor. I went out and I introduced myself, told him I worked at a hospital, thought maybe that would help, and said, then all of a sudden, we basically, I was worried. Now, think of yourself, Rob Aducey. If your son's in critical care in the hospital, what hospital do you want him in? You want him in the best possible hospital. Now, is that Rapid City, South Dakota, when you're in Chicago? I don't know. Didn't hit me as one. So I said to the doctor, where'd you go to medical school? He said, I went to the University of Michigan. And then I did my residency there. And then I did a fellowship in intensive care medicine, my residency in pediatrics. He said, I'm double board certified in intensive care and pediatrics. You know, and he said, the reason I'm here is because I grew up in Rapid City and I want to come back to my home. Do you know I went back into my son's room and I felt better? I didn't feel better that he was there, but I felt better we were in the right spot. So I think it's vital for people to know who's taking care of them. We taught a number of physicians this in Texas years ago. And when I showed up after other people had talked to him about introducing yourself, they said, you got to meet this radiation oncologist. And he said, you know, when I heard about introducing yourself, he said, I thought it was hokey. But my first patient to show up, you were wrong. We call it AID. He said, said I'm a radiation oncologist. First time they saw this cancer patient, but referred to him. Said I've been here for 22 years. I did my medical training here, my fellowship here, my residence here, and I've treated thousands of cancer patients. And he said the patient started crying. And he said the fourth patient cried again. And that day he went home and said he should have been doing this all along. That'd be one thing. Number two is really explanation. Another way, it's all about reducing anxiety. Another way to reduce anxiety is explain. When my sister was dying of cancer, she had a Whipple procedure and we didn't know she was going to die. She had pancreatic cancer. I wanted them to explain everything that was going on. Every light, every number, every movement. When she went into psychosis, because she'd been in the intensive care so long and had been dark, somebody said, well, that's normal. Gosh, I wish I would have known that because I would have not been near as afraid as I was. So I think really explaining things as well as you can, such as side effects of medication. You know, who's going to come in next? I love when one person introduces the next person. The third thing is duration. How long? Don't ever say soon, be right with you. How long will the test take? How long will I be here? How long before this can happen? So I think those are the three major, there's lots more, but those are three I would recommend. What's next for healthcare after the roller coaster of emotions? It's the aftershock. After we're having an earthquake, it's called the pandemic. And if you've ever been through an earthquake, there's that sense of once you think it's over, but then you deal with the aftershock. I live in Pensacola, Florida. We just had Hurricane Sally. And after the hurricane, at first you sort of go, whew, the wind stopped blowing. But then you go outside and you got a massive cleanup. And I think we have an aftershock. And the aftershock is the mental health impact that's had on our workforce, the exhaustion that's had on our workforce. And if we don't deal with that aftershock, this ain't just pull up your boots and go back to work. This is dealing with the human element that we've been dealing with in healthcare. What are some ways I can engage leaders to provide more research for emotional health? Hopefully, one, I'll send you a 30-minute video that I just did that you can show them, a toolkit. I don't see how they can avoid it right now. And it's sort of sad if they are, because this is going to come to another question. So hopefully, this 30-minute video I did for some people, but it's certainly available to you. The only thing I don't charge for anything, you know, I'm a tough negotiator these days. Everything's free. How do you deal with, now this goes into now some other things. How do you deal with deadlines and not having enough time during the day? That's life. But I also think that we have to start, depending on what your job is, it's sort of hard for me to answer that, but there's two things that will help drive performance: clarity of goals or expectations and prioritization. One of the things that I try to do, is we have a system called a 1, 2, 3. And we sit down with people and you put a 1, 2, 3. And that sort of helps people know where really the priorities are, where you're at with it, because that's it. And sometimes people they're afraid to not do something. They're afraid because of perfectionism in healthcare. So you got to sort of help people know, what do you have to be perfect in and what do you don't? Because healthcare, we don't live in the same world as other people. There are times you need perfection. If you remember when the Chicago Cubs won the World Series, there was a guy named Kyle Schwarber who's no longer with you, but he was your left fielder. People love Kyle Schwarber. You know, they loved him. and he made an error in a World Series game and the people still liked him. We can't do that in healthcare. We make errors, and that's the challenge. It's the challenge is this perfectionism keeps away from our humanism. So I think what we have to do is help staff sort of know when they have to be perfect, when they don't. And I know, please don't take this wrong, we still got to have fun. I have talked I do a podcast, and one of the things I just did Kevin Sheridan, it's not been on played yet because he's an expert on employee engagement. And one of the things he pushed is you still got to have fun. You still got to do some things that help you feel joy, because that's what we do. That's why we start every meeting out with, what should we feel good about today? What should we feel good about what's happening here? I have a friend who's suicidal, and he admitted it to me about 4 months ago. So every day he has to send me 3 things that he's grateful for from the day before. And I can show you these 3 things he has sent me from day one, and you can see him mentally getting better, basically because he's got to focus on 3 things to be grateful for, because it's impossible to be grateful and unhappy at the same time. Truly, when you think about that. And balance trauma, let me see. I don't think we ever balance life. I get so many questions on balance of life. I think we blend life. But we never balance life. Unless if you live to 77 years old, you'll have lived a balanced life, but it would just never be balanced when you're living it. I just look at my wife and I. When you got little kids, it's not balanced. Margaret had JP, she had Ben, and she had Maddie. Well, how balanced was it when you got 3 little kids? Okay, today, JP works for the Pensacola Blue Wahoos. Ben goes to, I think, Mississippi College. Maddie goes to the University of Arkansas. She went to the basketball game last night, by the way, Margaret. And now they're out of the house. She's got a different world right now than she had. So part of it is we're blending. We're trying to blend. And some days it's not going to be balanced. You're all in school. It's not going to be balanced if you're in school and you're also working. So I think one of the things is realistic expectations. But the other thing I'd recommend you do, and this is something you learn in treatment, I'm going to save you treatment. You write down what are the things you enjoy doing, and then you start writing down when was the last time you did those. And that's where the pandemic is getting harder, because normally in treatment, we can do those things. We just haven't done those things because alcohol and drugs have gotten in the way. But now something else has gotten in the way, even the opportunity to do it. If you say one of the things you loved doing was going to minor league baseball games last year, it did not happen. So we've got to start looking at what do we get pleasure out of, and when was the last time we did it? Because we've got to get doing some things that we can still enjoy. What career mistake has given you the biggest lesson? I worked in an unhealthy culture for too long. And the reason is when you work in an unhealthy culture, you start getting unhealthy yourself. It's, if you go into dirty water, you're going to get dirty. I was younger. I had kids. I had bills, and I didn't know how to leave. And the longer I was there, the less confident I got I could leave. It took me 3 years to finally leave. And I should have left earlier. So I think life is not worth being in a work environment that isn't healthy. And sometimes you don't know how unhealthy it is until you leave it. And then all of a sudden you say, so that's the pressure. That's the stress was on me. So that's my biggest career mistake. What has been the main factor you found in reducing healthcare worker burnout? Leadership. Do you have the right leadership in the organization? Have they provided you a toolkit? Have they making sure they're talking about systems? Have they made some adjustments in the situation? Have they helped you? I'm on the board of Tri Health, and don't understand it's great, but they gave 12,000 employees $500 extra this year in a time when everybody was sort of getting hit. We just did that in our organization. We just gave some bonuses for working through COVID. Now, not everybody wants to do that, but it also, do you have the right tools? Do you have the right equipment? And I think talk about mental health is huge at this time to let people know it's okay. Coming from a non-healthcare background, how were you able to progress? I thought I talked about that. you know, it's ironic. I was on a phone call today and they said, Quint, you run baseball team. How can a guy in healthcare run a baseball team? So I say, well, in healthcare, you do this, and it's a lot like this in baseball. We are not terminally unique. Our skills transfer, our leadership skills transfer. And I found that over and over and over again. So I think that really hits, I think, almost all the questions. There was a question on Epic and Cerner. And if I miss anything, if you put anything in the chat room, if you want to add any questions, I will do a Zoom recording where I can go in even more detail and I can answer these types of questions for you. As we wrap up, I'm writing this new book called The Calling. And a couple things I'm finding. Many times it's about getting our insides right to get our outsides right. It's not the next book. It's not the next consultant. It's not the next motivational speaker. It's not the next this. It's what's keeping us from maxing our own human potential. I know what I go through. I go through denial. I don't want to look at me. I go through blame. I blame somebody else. I go through rationalization. I go through various steps that keeps me from focusing on me. But I think once I remove some of those blockages, then I became teachable. The two things that I think drive everyone is self-awareness and coachability. And once we become self-aware, we become coachable. The other thing I found in writing my book is how, and I know we're lucky people. And you might say, how are we lucky people? First of all, we get to do what we're passionate about. Why were these last 5 years been so tough on me? Because I couldn't do what I was passionate about. But we get to do what we're passionate about. Most of us, we work in healthcare, get enough money that we don't have to work other jobs. My dad died 6 years ago, 6 years ago on January 26th. If you follow me, I write a column for some newspapers every Sunday, and my column is about my dad this Sunday, what I learned from my father. And my father loved duck hunting. When he retired, everything he got was duck hunting. He worked 41 years for General Motors in Chicago. And then on weekends, he worked at the Pilot Brothers junkyard. And why did he work 2 jobs? So he could fulfill his passion of duck hunting. We don't have to work 2 jobs. We're some of the lucky ones. We can do what we're passionate about. We can do what we're good at. We can make enough compensation so we can continue to do what we're good at. So my commitment today is, as much as it's been ever, is you work too hard not to have a great place to work. So our mission statement is Studer Group, which I'm, again, no longer with, but it's still my mission statement because I wrote it years ago when we started, is how do you create a better place for people to work, for physicians to practice medicine, and for patients to get care. And that's really what we exist for: purpose, worthwhile work, and making a difference. Thank you very much for allowing me to be with you tonight. Thank you.
Thank you, Quint. Just to finish up, so I've seen some questions in terms of the recording for tonight. Folks that want to get it, we should be able to send out a link after we get that downloaded. And I think likewise, a number of the resources that Quint mentioned, we can share to folks that RSVP'd or were participants. So I don't think there's much more to say. Quint, you said that we were a lifeline for you. I'm glad we could be one. But as I've learned in a very short period of time, it reflects the graciousness that you always exude, and your modus operandi. I truly feel as though you've been our lifeline and have really helped pull us up tonight. So thank you so much. And
thank you
for attending.
Thank you very much, everyone. Hey, stay in touch. I'm on some social media. That's my email. That's my cell phone number. Any resources, anything I can do, just let me be helpful to you. Okay. Thank you very much. I appreciate it. Have a great night. Thank you.